They have a right to be afraid of that happening.
False kind of beliefs about their manhood.
But that's countered significantly by the fact that if they don't do something, they're probably going to die.
I'm always stunned and surprised by how little people know about their own bodies.
Sex really happens in our head.
Sex after losing a prostate is fabulous.
It's fabulous, can be actually much more enjoyable for a woman. There is still clitoris for those men who are watching. Remember clitoris?
That's right, they've got to know how to find it.
Well, g'day again, Dick. Good to see you, mate.
Steve, how are you, mate?
Hey, we've got a special guest today.
We do. We've got someone who's decided to join us for God knows what reason. But we're very lucky and fortunate to have my partner, actually. So I'm probably more fortunate than anyone, but who is a doctor and actually a psychiatrist. Hence, you can see why we're probably a partnership. And she is here to add another perspective to what we're talking about with regard to prostate cancer. Her name is Dr Marzena Rybak, speaking about Marzena in the third party. She's from Poland, and she's here to give us an opinion on what she thinks men can and can't do, and the fact she knows, and we all know, that cancer is a significant problem. It may be as many as 1 in 6 men are affected by prostate cancer. And some of Marzena's patients actually have, as she will tell you, declined to take treatment when it was necessary. And so there's a whole raft of other factors involved in this process as to why men don't want to help themselves. We've touched on the fear factor, Stephen and I, throughout these discussions, and that's one of them. But there's other reasons. It's almost like a lack of really accepting it's going to happen to them and not being afraid, just hoping that it's going to go away.
Previously, we've spoken about, the other person in a man's life, and they are a significant factor. And the fact that your partner's here, who also has, a medical background, a human medical background, and is a psychiatrist, is significant. So, Marzena, great to see you.
Thank you for inviting me.
Thanks. So I might just start off with what you've experienced in your career as a medico-psychiatrist with men with prostate disease and with their partners, and what the impact is on them.
So I may just start by saying that I would like to kind of talk from two perspectives, as a doctor and as a woman. As a doctor, I'm not an expert on prostate cancer. I'm a psychiatrist, and urologist is a better person to discuss prostate cancer with. But I did come across a number of patients who were my patients who suffered from prostate cancer, or my female patients and their partners or husbands had the illness. And I have to say that in 1 or 2 cases that I can recall from the top of my head, the partners, they were actually not my patients, refused treatment. The end was terribly tragic. And they refused the treatment because of false kind of beliefs about their manhood.
Yes.
I suppose that's what comes down to. Because they were diagnosed, so they obviously went to the doctors at the initial stages. They went through the PR examination, so the per rectum examination. They went through all that, and then they declined, which they had right to, declined treatment because they worry about not being a proper man is one of the...
It's interesting you say that, and Steve, I mean, the point is that if a man, and they're right, thinking if I have an operation, there's a possibility I may not be able to function as a man, i.e. get an erection going forward, they have a right to be afraid of that happening, but that's countered significantly by the fact that if they don't do something, they're probably going to die.
Well,
they're not going to enjoy their sex life.
But they're the plain facts, Dick. What we're talking about here is the human mind and psychology.
That's right.
So,
That's right.
Marzena, Dick and I have touched on embarrassment, myths, fear, anxiety. Now, these are all...
Gorillas.
Gorillas. These are all, emotions that you deal with on a daily basis.
Absolutely.
So if you had a man as a patient, a client, that had prostate cancer and was refusing treatment, how would you as a psychiatrist / medico try and lead them down the path of a good outcome?
That's a very good question because, in most of cases, I could convince my patients or the partners of my patients. And it's I often use the analogy, a lot of people, especially a lot of men, don't want to use antidepressants because they may have sexual side effects. And my counter-argument is that there is a percentage, the chance that you won't be able to have erection or have sex drive when you take antidepressant. But when you're depressed or anxious, you're not going to enjoy your sex life anyway, because you're just not equipped, your brain is not interested. The same applies to the prostate cancer. I think that men worry and they hear, horror stories and read who knows where, that after you remove the prostate, you stop being a male. And I always say, remember, you still have your testicles. A lot of men don't realize where or how big or where anatomically placed prostate is. So that's also some education really helps.
Totally.
And then I say to them, if you remove your prostate and do what the doctor tells you to do, you still have pretty good chance to have a happy, kind of healthy sex life. If you refuse it, you may enjoy your full masculinity for a period of time, but after that, you won't be able to do anything anyway.
Yes.
And once the metastases go to your bones and to your brain,
it's over.
The game is over anyway, and your penis is not going to work.
Sure.
And as I said, and I can recall one or two who, despite that, and I spent kind of long time and effort in convincing them, those two men just refused.
Yep. And what was the basis of that, do you think?
The cultural background is very significant. The man feels that he's only a man when he can perform sexually well.
Yes.
And I always kind of joke, I say that men generally overestimate the significance of big and hard penis. Women don't look at men in that way. That's the perception most men hold, but for women that's not that important. And even if you're that unlucky, in my opinion, even if you're that unlucky, you will lose or most of your premorbid sexual function, you still can satisfy a woman in many ways.
So the winner out of all of this is the woman.
That's right.
I knew there was a catch somehow.
If you want some kind of medical weird statistics, there is statistically we know, and I don't know who does those studies, but we know that only about 30%, depending on which studies you look at, only about 30% of normal women are able to get vaginal orgasm. The other 70 or 80% can't.
Yep.
So here is the man kind of worrying about size and the stiffness of his penis. The woman doesn't care about that, really, in most cases. Women can be satisfied in other ways.
You touched on a really good point, and one of the early chats that Dick and I had, we talked about what is a prostate. And as a medically trained person as you are, I'm always stunned and surprised by how little people know about their own bodies.
Absolutely.
They don't even know what their liver does, for instance, and they just don't get stuff. And, you'd think as a man, at least, you'd want to know what your prostate is there for. So if something goes wrong with it, well, what's the consequences of that? So I think that education piece is absolutely critical.
Essential. It's essential. And just to follow on that line. So prostate is just the small gland, about the size of the walnut, which is placed just under your bladder.
Yes.
And it surrounds your urethra.
Yes.
So I don't know if you discussed it. We probably haven't. If I'm repeating myself, just
we've touched on it, but it's okay.
We've touched on it from a street definition.
Well, I couldn't touch on Dick's because he doesn't have one, but
that's right. It's a little bit personal.
In simple terms, the prostate fulfills two roles. One is producing the fluid to protect and support sperm.
Correct, and make semen.
And make semen. And another one is a muscular spasm, if you want, during orgasm.
Yes.
So it helps with ejaculation.
But it also helps control urination. So, early signs of prostate disease can be not able to urinate freely or frequently going or dribbling small amounts.
Dribbling small amounts, that's right. Because when you think about the physical, anatomical kind of placement, it's just under the bladder, so it presses on the bladder, hence blocks the flow.
And it can
of
also
urine.
press on the colon too, so it can be constipation and things like that.
Absolutely. So it is a small organ, but very significant organ, and men worry that once that little organ is removed, they won't be able to produce children or have orgasm ever. And those are kind of myths, because yes, you still can have children. You can either collect the sperm before the procedure or you still have testicles.
Yes.
You can remove sperm from testicles and then have in vitro fertilization of your partner. But as to the orgasm, they called dry orgasms. So the man is still able to have the orgasm.
Yeah.
He just won't ejaculate.
Yes, it's all about you, Dick.
Well, he's a hero of the moment.
I just wanted to make the blokes out there who think maybe it's not going to happen again.
No.
That, let me tell you,
Well,
it happens.
Marzena, while you're here, let's chat about, Dick and I have touched on tantric sex and Kama Sutra, and, you've already said that there's other ways that,
That's
partners
right. And there is
can...
still clitoris for those men who are watching. Remember
what is that?
clitoris?
Oh, that's right, they've got to know how to find it. There's a lot of men now looking up the dictionary. Some bloke's probably got an atlas.
Just ask your wife to direct you gently.
Yeah, and listen. That's
she
the
will
most
be happy.
important.
That's right. And I think it is terribly important that the woman is involved and that the woman is a co-partner. And, yes, can the relationship get broken? Of course it can, but it probably was fragile before the prostate cancer or illness happened. So if you love each other and if you listen and if the woman doesn't take it personally and doesn't think that, that lack of erection or not 100% erection has something to do with her, no, it doesn't. And I often have those conversations with my patients about their medication. I quite often say to my male patients, I say, if your erection or lack of desire is not that great because you're on antidepressants or any other psychiatric medication, talk to your partner and tell her it's not her, it's the medication, blame me. So it's a bit like that with the prostate cancer or prostatectomy, that it's not about the woman.
So
actually, women can show and shine in that.
Sure. So if a man's greatest fear is loss of manhood, and I guess we relate that back to our sexual prowess.
That's right.
What you're really saying is sex after losing a prostate is fabulous.
It's fabulous. Can be actually much more enjoyable for a woman.
Even with
just saying that. He was wonderful before and he is wonderful after. But
yes, you didn't know him before.
I told her.
That is my very subjective opinion. But it shows you, and it would be brave on the men because that's true. We haven't met before. We only met after Richard's diagnosis, and of course it causes anxiety in any man, especially at a certain age. With an illness, you meet a new woman, you want to impress her. And he did, by the way. But, I understand. And in terms of kind of therapy for men who have the surgical procedure done and they survive chemotherapy, radiotherapy, whatever they need to have, you have physio exercises, sex therapists, so the psychiatrist, I'm not an expert on the field, but it's a subspecialty of psychiatrist or sex therapist, and then pharmacological treatment.
Yes.
So you have a lot at your disposal to improve your performance. And then and people often forget that sex really happens in our head.
Yeah.
So if you convince yourself that you can't perform or you're not going to be the same man after the operation that you were before, then you're gone anyway. That's not going to work. In my practice as a psychiatrist, I see a lot of, especially young or middle-aged men who have difficulties with sexual performance, let's say, and in 90% of cases, it's not anatomical or physiological illness. It's mental.
Sure.
Because they're anxious or they haven't performed once for whatever reason. They were drunk or tired or whatever. Then they got it in their head that they can never perform again. Right. And with each next attempt, they convince themselves more and
anxiety.
More anxiety, and they become impotent.
The situation, as Marzena said, that there's alternatives.
Yes. And
thank God there's an alternative to Cialis with Viagra, because the Cialis gave me indigestion.
Yeah, right.
Yeah, I know. It was a very downside. I thought, Jesus, you can't win a trick here, But the bottom line is that there are other things, and clitoral stimulation that Marzena touched on, it's really interesting that 70% of women have found something other than complain about than an erect penis. So if that's the case, then for those guys who are having their prostate out, there's real hope here.
Yeah, great.
Make no mistake. Yeah,
that's exactly right.
Well, Marzena, thank you. I mean, it's wonderful you get a psychiatrist insight.
If I can close on my doctor mode, not on my girlfriend or partner mode, men out there listening to that podcast need to remember that prostate cancer is, apart from mild skin cancers, is the most commonly diagnosed cancer in males. So that's the first thing. It's, in terms of mortality, is the second most common cause of death from cancer after the lung cancer in males. So that's worth to remember. Prostate cancer is a dangerous illness. And statistically, 1 in 5 to 6 men will get prostate cancer before age of 85. So keep that in mind. It may happen to anyone. So don't be foolish.
I think the important qualifier there too, Marzena, is one of the few cancers that is almost completely curable.
If it's caught early and if it's treated appropriately.
There's not a lot you can do about lung cancer or pancreatic cancer.
That's exactly
but prostate cancer is treatable and curable.
Curable. And you can test it or keep an eye on it just through a very simple blood test before you have to head to the doctor and have the PR examination.
Sure.
So just keep that in mind.
Yep.
On that note, I think...
Thank you, Marzena. That was great.
Yes, rose amongst thorns.
We hope you got something out of this episode. If you did, chances are you know someone else who will. So let them know about the podcast too. And we'd love it if you rate this on your podcast app. We want to spread this far and wide and hopefully save some lives. Thanks for listening.